be able to get that set up. Yeah, I think I can. So thank you for your patience. Again, don't have my team with me tonight, so I'm looking at flying solo and a lot more tech glitches than usual even. Now, if you look at coronavirus testing, this is just one graph, one way of looking at it. Tests per million people. South Korea, by far the most, with 3692 tests per million people. Guangdong, China, with 2,820. Now Italy's up to 826. And way up at the top, with the very least, is the US with 5. A lot of people are saying is there's been a lot of discussion about should we do more testing? Should we open that up? The difficult reality right now is that there's not enough testing kits out there to do that. But you go back and you think about the numbers that we were just talking about, and there's a lot of evidence that one of the reasons that South Korea was able to contain their epidemic was, to the extent that they could, was that they came out hard and fast with a lot of testing availability. Again, you see some of the problems with the outbreaks with Spain and Italy. Now, let's go back and take a look. Most of this video is going to be about the CDC guidelines for corona testing, how to find the guidelines, what the guidelines say, and for the rest of this, I might not do much editorial focus or debate. So how do you find the CDC coronavirus testing guidelines? First of all, go to this link, www.cdc.gov, coronavirus/2019 /cases, updates, testing in US HTML. That might be hard. And if it is, just Google CDC coronavirus testing. Once you do that, click on the first choice, the #1 place in the search engine results page. I'll see if I can get there on this for you. Yeah, you click on that, and here's where you go, coronavirus disease testing. I'm going to go back out for purposes of this presentation to talk a little bit more about where you go here. As you see, testing in the US, this is the CDC the Centers for Disease Control and Prevention websites. Testing in the US. Now, it talks a little bit about testing, and it's talking about updating the testing. It'll be updated daily. And again, maybe I can't avoid a little bit of editorialization. My guess is they're going to be pushing testing more as soon as the test kits are available. As I've mentioned, I'm working with a group that's setting up a national retailer for testing. As we look at other groups, this testing, again, just had a significant amount of testing available at the University of Cincinnati. We went up and did some benchmarking with them. We thought it was available, but then when we got there were very few tests done. Why? The procedures, the testing locations, the people to do the tests were all available, but the kits were not. So let's go back and go through the navigation in the CDC website. So go here, symptoms and testing. Once you get here to the testing in the US, symptoms and testing. Where that takes you next is a symptom and testing center. You've got 4 buttons you can push: coronavirus self-checker, symptoms, testing, and reducing stigma. So let's click on testing, and you get a brief review of the symptoms. Then it refers you back to the symptom checker. So click on it. Testing for COVID-19. First of all, it says in yellow, right at the top, call your doctor. If you think you've been exposed to COVID-19 and develop a fever and symptoms, call your doctor. Symptoms such as cough or difficulty breathing, call your healthcare provider for medical advice. And then the next place you can go, they suggest, is the coronavirus self-checker, a guide to help you make decisions and seek appropriate care. So as you see, it's talking of, the title is testing for COVID-19, but really it's talking about symptom checking and calling your doctor if you have symptoms. So next it says, if you're in close contact with someone with COVID-19 or a resident in a community where there's ongoing spread of COVID-19 and develop symptoms of COVID-19, call your doctor, call your provider, tell them about your symptoms and exposure, and then they'll decide whether or not you need to be tested. But keep in mind that there is no treatment for COVID-19. And people who are mildly ill may be able to isolate and care for themselves at home. So again, if you think you might need testing, well, call your doctor and remember there's not a treatment, but again, redirect you back to practical care as opposed to testing sites. So if you're at higher risk for serious illness, that's the next section of this quote testing site. People at higher risk should contact a healthcare provider earlier, even if their illness is mild. So in other words, high risk, contact your healthcare provider. Older adults and people who have severe underlying chronic medical conditions like heart or lung disease, diabetes, etc. Things we already know. Again, mention of risk factors. If you're sick and get medical attention, go get medical attention immediately. Well, if you're very sick, get medical care. Sick, and then they go list the things like difficulty breathing, persistent chest pain, new confusion, not arousable, bluish lips or face, and other things. And it's like, go get care. Don't pass go, don't get testing, go get care. So even though we're in the quote testing site on the CDC webpage, it's all about practical advice on how to manage you in terms of care. So, and then they've got a last section on healthcare professionals and interim guidance for healthcare professionals. So again, not really that much about testing. Now, the testing section will then send you back to the symptom checker. Let's go back to the symptom checker. So that's what happens when we go through the COVID-19 quote testing site. It's all about practical applications of looking at symptoms, and call your healthcare provider. If you have serious symptoms, don't worry about whether it's COVID or not. Go get care. If you're blue in the face or bluish lips, if you can't breathe, et cetera, et cetera. So after talking about practical management of symptoms, then they go back to the self-checker. Excuse me just a minute. James, I'm on a YouTube Live. Can I call you back? So sorry about that. That was the fellow that I'm working with on this retail testing program, and I didn't know if that was an emergency or not. He said, fine, go ahead and continue. So thank you again for your patience as we go through this. So now we've gone through the quote testing page on YouTube, the CDC site. It's about symptoms and practical management of symptoms and practical management of care. It's not about testing. Then they send you to the coronavirus self-checker. Now let's go through the coronavirus self-checker. Again, it's a symptom checker. It's helpful, but again, it doesn't get into testing. The purpose of the coronavirus self-checker is to help help you make decisions about seeking appropriate care. This system is not intended for the diagnosis or treatment of disease or other conditions, including COVID-19. This symptom is intended only for people who are currently located in the United States. This project was made possible through a partnership with the CDC Foundation and is enabled by Microsoft's Azure platform. I agree. So I go in and I agree. First question is, are you ill or caring for someone who is ill? I said, no. Sounds like you're feeling okay. The self-checker system is for those who may be sick. Learn more about COVID-19 and go back to the CDC website. So I went back and it said, okay, first question, are you ill or caring for someone who is ill? I said, yes. Where are they located? Where are you located? United States. Are you answering for yourself or someone else? I just said someone else. What's their age? I said 60 to 64. What's their gender? I said female. Are they experiencing any of the following life-threatening symptoms? Gasping for air, cannot talk, blue covered lips or face, severe pain or pressure in the chest, severe constant dizziness or lightheadedness. Again, does that sound familiar? This symptom checker is going back to the symptoms listed for serious illness, life-threatening symptoms in the previous section on testing. So, slurred speech, etc. So if you have none of the above, then they ask you a next set of questions. Moderate to severe difficulty breathing, unable to speak full sentences, coughing up blood more than a teaspoon, signs of low blood pressure, feeling cold, pale, clammy. And I hit none of the above. Okay, so in the past 2 weeks, have they had contact with someone diagnosed with COVID-19, live in or visit a place with COVID-19 is spreading? I'm going to say, I think I said no on that one. No. Okay. Do they have any of the following? Fever, feverish chills, sweating, shortness of breath, cough, others, submit. And I said cough. Do they live in a long-term care facility or nursing home? I said no. In the last 2 weeks, have they worked or volunteered in a hospital, emergency room, clinic, medical office, long-term care facility, nursing home, ambulance service, first responder services, or any healthcare setting, or taken care of patients as a student or part of their work? And I said no. So then it says, do you or the person you are caring for have any of the following conditions? Chronic lung disease, congestive heart failure, diabetes with complications, neurologic conditions, weakened immune system, dialysis, cirrhosis, etc. So I said none of the above. So what does it tell me? Stay home and take care of yourself. Call your provider if you get worse. Sorry you're feeling ill. You have one or more symptoms that may be related to COVID-19. Stay home, take care of yourself, read 10 ways to manage your health at home. Follow these steps to help protect others from getting sick. So, as you can see, once you actually go through the symptom checker and the details of the instructions for, quote, testing by the CDC, it really gets back to either A, let's go way back to their original guidance. If someone is in the hospital with a COVID-related illness, yes, you should test. Number 2, if you're a healthcare person in the hospital caring for someone with COVID-related disease, yes, you should have a test. Anybody else, you sort of get into this circular thing about it's not really clear who and when they actually would recommend testing. What they actually do is take you through like a triage, a self-symptom checker triage system to figure out how you should take care of yourself. If you've got symptoms that are life-threatening, then go seek care immediately. If you've got symptoms that are moderate, go seek care immediately. Now, we could go back through there and say, oh yes, we have had exposure to people in a nursing home. At that point, maybe then they'll recommend testing. Now, again, that's a concern. And why is that a concern? Let's go back and take a look and see if there's actually anybody on the YouTube Live tonight, which I'm excited. I was actually able to set up myself. Let's see if there's anybody on this YouTube Live. And if so, we will entertain questions. Bart Robinson, how are you? Good to see you. And let me stop the share. There we go. If we don't get any questions, I'll go ahead and close it out. Now that I know that I can actually make the technology work, I may start providing some updates over the weekend. So Bart Robinson, good to see you giving us updates, sir. Good to see you're interested. Actually, good to see that I could actually get through with this update. Whitetail obsession, outdoors. Just want this to fade out and stop hearing about it all over the news and social media. How long do you think this will go on for? Oh, that's a great question. I keep thinking through for myself, how long will it go on? Couple of things. I mean, we're as a culture in the US, we're wrapping our head around social isolation. If you start looking at groups like China and Italy that have lived through this, and South Korea that have lived through this, you see that social isolation seems to help. So again, we've made maybe a pretty good step into step one. Now that we've cleaned the masses off of the beaches in Miami and other places. But we've not really done significant lockdown. I read and heard that the state of California actually did a lockdown. There are other places like Austria, which are saying, look, if we see a gathering of more than 5 people, we will fine you. Israel's doing that. Vienna's doing that. We're starting to see some of that in Australia, I think, some places, some jurisdictions. But right now, this is a jurisdictional type thing. I don't see any federal recommendations or guidance or mandates for a lockdown. That has had much more of an impact in China and other places in terms of slowing the impact. The other thing that's had a significant impact is case finding, isolation, and quarantine. Now, what's the difference between isolation and quarantine and social isolation? Here's the thing. Social isolation and quarantine means that you've actually found a case. Actually finding a case brings us back to the theme of this video, and that is we don't have enough testing out there going on to actually find the cases. Michael Osterholm has said, you know, even after we wrap our head around how much transmission has occurred so far, it's going to take 2 months to figure out what's working and what isn't. I think that's a really good point. So to me, it's going to take another 2 to 4 weeks to sort out all the transmission that just happened on the beaches in Miami and other places where people were still continuing to congregate. Now, from a sourcing perspective, it does appear to that test kits en masse will start becoming available early to mid to late next week. Sometime next week, hopefully, we'll start getting a lot of coronavirus test kits available. When that happens, I expect that the CDC recommendations and guidelines around coronavirus testing will change. It will open up significantly. At that point, there'll be encouragement of a lot more testing. Once that happens, within 2 to 5 days of a lot of testing going on, then we're going to start finding what South Korea found. We're going to start finding all of these cases that otherwise would have been unknown and out spreading the disease. Nature magazine's got a couple of great articles on asymptomatic individuals finding disease. For example, there was a recent group of world-leading geneticists. There was about 24 at the group. A few days, I don't know, what was it, maybe a week or so after the group met, they got a tweet from one of the attendees, and he said, I'm in the hospital, ICU, guess what I've got? Coronavirus. So many of these geneticists had gone on, they'd visited family. One of them had an 84-year-old mother, 80-year-old father, both of whom had some disabilities and risk factors other than being in the 80s. And that person had visited them. So that person had every reason for concern and fear. Maybe I was infected by this other geneticist who's now in the ICU. Maybe I have, when he didn't have symptoms, maybe I didn't have symptoms and I infected my parents. So you still got way too much of that going on. And you will continue to have way too much of that going on until we start to get significant increase in the testing here in the US. Again, you go back to that very first slide. The US has been very, very slow in terms of getting testing out there when a huge need is there. Again, social isolation has been a major step forward for us. At least we're not like Italy, we're not like China. You look at some of the modeling of this disease, it's been dramatic. Huge spread with China and huge decrease when China did the lockdown. It was like, I plan to cover that. There's a great article also in Nature magazines talking about, had they just done this lockdown a week or two earlier, they would have decreased the number of cases by like 70%. Again, we're in geometrically increasing spread mode. So any slowdown that we can affect now early moves us more towards the Korea curve, which you saw was flat. Maybe you're looking at me, so it's flat, as opposed to the China Wuhan mode, which was a hockey stick, and Italy, which was a hockey stick, until severe lockdowns were enacted. So great question. Again, I hope to do some more YouTube Live events this weekend, sharing some of that information regarding modeling of the pandemic in other parts of the world and what we can learn from those models and from testing, what we can learn about the value of social isolation versus actual lockdown versus testing, case finding, and isolation of cases. Cranium lost, hi. K King, BBC said this would last a year off and on, letting us out for a while and locking us down again. Yep, I do see that's likely to happen. There's a lot of possibility for that. Again, here's why. Once the countries and we as a culture start getting our heads around a combination of self-isolation and or lockdown and or case finding, again, testing, case finding, and isolation around those cases, then there are going to be episodes where cases break out. We will probably start getting back out at some point, like they are in China. But again, cases will start happening, outbreaks will occur, clusters will occur. There will be a massive testing and case finding episode and blanket thrown around that area. And then that group of people will go back into isolation until we slow down transmission again. So Kevin McCord, unfortunately, the CDC symptom checker seems that it will funnel a lot of people into an already overburdened, easy for you to, even not easy for me to say, huh? Overburdened medical system without directing appropriately to medical test centers. Absolutely. And again, Kevin, thank you so much for attending. Kevin's a great preventive medicine doc, just in the Cincinnati area. Hope to be doing some work with Kevin. Hope to see him join us over the near future if possible. But again, that depends on what other things that Kevin's working on. Thanks again for your attendance and interest. Yes, I do expect over the next week to see major changes in the availability of test kits. Once that happens, I do expect to see significant national testing programs starting in the US. The president's already announced a few. I'm participating with one, and we're planning on rollout, at least of the pilot projects, mid to late next week. Kathy Jensen Butahiri, is it safe to get fresh fruits, any vegetables, or any groceries in any special preparation? How about bread? Haven't seen anything on how long viruses last on good. So viruses there's a lot of research going on how long the viruses last, and it's hours to days. And here's the other thing, viruses last in the air, hours, and it may be up to days, but clearly hours. So you go to the grocery store. My wife has broken our social isolation a couple of times to go to the grocery. She thinks it's helping because she goes early in the morning before a lot of other people are there. I'm not too happy about it. You know, she makes her own decisions, and, you know, just like everything else in life, we're a couple. Her decisions may kill me. That's what it is. I've got a lot of patients that are calling me saying things like, well, I'm going to have I've had a knee surgery scheduled for several months. Should I cancel it? Yes. Well, let's just think about it. You could breathe the wrong air, breathe in some virus, get infected, and die. So, which is more important, getting that knee surgery that you've been waiting on it for 6 months, and yes, it hurts, or living past the next few months? Use some logic. So same thing with food. Be very careful. I actually have a lot of canned foods available. I also have a lot of canned avocado oil and olive oil. So I'm getting a lot of calories out of avocado oil and olive oil spread liberally on things like, we had some eggs. We ran out of eggs this week. Now I'm going to be adding it to canned beans, some other things. I think I can last a few more weeks, and we'll probably have to go to the grocery store again. I'm getting stuff that was canned, heated and canned, and again, using olive oil around it. I'm not getting a lot of fresh vegetables and fruit. I'm not getting any fresh vegetables and fruits. I did have a patient send me some since prior to the event, the COVID infection, the pandemic. I still had, they were oranges. They're the first oranges I've had in years since I went low carb. They're blood oranges. They're fantastic. Thank you, Richard. And so I'm eating one of those every 2 or 3 days. Those will run out in about a week or so. K King, China's been locked down for over 2 months already. Yep. You know, if you go to the China government television, it's on YouTube, and it's in English. So obviously it's not for the Chinese. It's for, so much as it is for showing the English speaking world what's going on in China. There's a lot of Chinese television information on the joys and the blessings of staying at home. So absolutely, which is maybe Chinese, what's the word I'm looking for? Chinese propaganda speak for, you better stay at home. They are in lockdown. While I'm thinking about it, just want to repeat a few things fairly quickly. ACE2 inhibitors, let me see if I can find that real quick. ACE2 inhibitors, aspirin, acetaminophen, things like that. Just a rundown on a few of those things as I know them at this point, with the caveat that I've investigated most of them. These all are tending to be a rapidly moving target. So, well, no, I'm not going to be able to find it. So aspirin, if you're taking baby aspirin to prevent heart attack and stroke, that appears to be safe right now from everything that I see. ACE inhibitors and ARBs, that has become a big, big issue. And I've done a couple of videos on those, already. They're a big issue because the coronavirus itself uses ACE2 inhibitors ACE2 receptors to get into the cell. So the logic has actually gone 2 different directions, and there have been publications in 2 different directions on this issue. Oh, if you take ACEs or ARBs, you're going to increase the amount of ACE2 receptors. You think, how could that be? And again, the logic is that causes the cell to make more because you're pushing against them. Therefore, that's why you see the preponderance of high blood pressure as a risk factor. The reality is you go into the science and that's not true. Other folks have said, no, take an ARB or an ACE because you're blocking the virus from entry, because you're blocking that ACE2 receptor. Also, no scientific evidence that that's the case. So people usually ask after I go through some of the science on something, well, what are you doing? I take benazepril, it's an ACE inhibitor. Any of these things that ramipril, lisinopril, benazepril, any of these things that end with PRIL are ACE inhibitors. They are excellent, and they're very popular blood pressure medicines. They're excellent for stabilizing and reversing the effects of cardiovascular disease and specifically diabetes. I'm not changing mine. I'm not recommending that any of my patients change those until we know more. Now, if somebody needs to go on a blood pressure medicine new, I'm not putting them on one of the ACEs or ARBs yet. I just go with a simple calcium channel blocker usually. But again, give this time, this will shake out as well. There was a couple of, I am blanking on the medications. They were, somebody fact check me. It's the VIRs. They end with VIR, ritonavir or something like that. Medicines for HIV. They've tested those. Yes, one of those tests, one of those randomized clinical trials came back from in the New England Journal just this past week. Those AIDS antivirals did not appear to work. How about zinc? Again, a lot of logical evidence that zinc has worked, and yes, some evidence that zinc has worked in clinical trial. Well, similar to some clinical trials, some science work with other coronaviruses, not COVID-19 yet, but others. So yes, guess what? There's been a run on zinc. But here's the thing. Zinc has it's an ion. It's a charged ion. It's +2. For those of you, science geeks who know about that. And ions don't get through cell membranes very well. So you then need to start thinking about things that are called ionophores. And the ionophores, there are a couple of ionophores. Someone has mentioned quercetin. There's been some discussion about quercetin in on the airwaves. And the big discussion has been on chloroquine and hydroxychloroquine. Actually, there's some information, I think some clinical trials. I know that there was some comparisons head to head between the old standard chloroquine and a newer, but still old standard Plaquenil or hydroxychloroquine. And the hydroxychloroquine worked a lot better. What are my thoughts? I'm not taking chloroquine right now, but I have a few healthcare workers, doctors and others who are familiar with this and have asked me as their care provider, would I prescribe hydroxychloroquine? And yes, I have done that. So I do think that there's enough to justify prescriptions for that right now. Hydroxychloroquine and chloroquine both. Hydroxychloroquine is already used often for other diseases like lupus and rheumatoid arthritis, some other inflammatory diseases. It also is actually even approved for use with diabetes in India because hydroxychloroquine does decrease, it improves sensitivity to insulin and it actually decreases blood sugar. So there's a lot of dots connecting around that area, that space. But you have to be careful with hydroxychloroquine. It's been associated with blindness. It's been associated with damage to the retina. Several other things. Now, those tend to be more long-term type things. You really start looking for retinal damage and blindness after 5 years on hydroxychloroquine. So again, maybe not so much a short-term type of issue, but clearly a long-term issue. And clearly something that somebody needs to be aware of if they decide to start taking hydroxychloroquine. So that takes us through several different questions out there. Oh, it didn't talk about acetaminophen and nonsteroidals. Here's some of the question and debate around nonsteroidals. People want to often take nonsteroidal anti-inflammatory drugs like Motrin when you get a cold or a flu. Now, here's the problem with that, and here's what many people have pushed back on, saying, look, do I take Motrin when I've got, or Advil when I've got potentially coronavirus? They flip-flop a couple of times. Here's the thing that I think is wise right now about that, and I plan to cover that in more depth later this weekend. I wouldn't take those. How about acetaminophen? If you have to take anything, I would rather take acetaminophen if I have potential COVID symptoms than Motrin or Advil at this point. Again, give me some more time. Let me study a little bit more, and I plan to come out with some more conclusive information about those later this weekend. So let me go back and start dealing with some questions if I can find them. Okay, Kathy Jensen, okay, Kay King, Kevin McCord. Symptoms at onset of COVID-19. Uh-oh, darn it, it moved, and now, okay. Symptoms at onset of COVID-19 may mimic other common illnesses. Dr. McCord says testing will help distinguish individuals potentially at risk for a deteriorating clinical course and halt community transmission. Yes. Actually, I'm not sure what brought this, why this reminded me of this issue, but I'm going to provide some information on it. As we're developing some of our testing systems, we've gotten a lot of suggestions to use the antibody test, a quick test, the rapid test. And that sounds good because you can get it quicker, you can get immediate results. What we're using instead is PCR. I'm having a senior moment. I worked at a genetics lab for 3 years, and now I can't remember well, can't remember. Here's the thing. The PCR is actually testing for the genetics within the virus itself. So it's testing for the presence of the virus. The human antibody tests are very different. They are testing for an antibody that we are making in response to that virus. So yes, it may become, it may be a rapid test, may be less expensive, may be easier to get at some point. But here's the downfall of the rapid test, the human antibody test. You can, as we already know, a major problem with this disease, perhaps one of the biggest things that's creating its lethality, is the super spreader, the huge number of people that have no symptoms whatsoever and yet are spewing the virus out and infecting others without even knowing it. A lot of those people probably haven't developed antibody yet. So again, that'll become much clearer as the situation develops. And again, will there be a use for the antibody test? Oh yes, no question. As we start getting to the other side of this lockdown, social isolation, quarantine process, it's going to become a critical question. Do you have the antibody? If you do, there's very little evidence that you're ever going to be able to spread it again. There may be some exceptions, but on the rule, that's people that are antibody positive are going to be in a whole different space. They're going to be people for whom the R0, the reproductive index, drops to little or nothing. So there will be huge use for the, maybe you thought it sounded like huge use, huge use of the antibody test, because the best situation to be in at some point will be to be antibody positive. Now, why doesn't everybody go out and get infected so they can become antibody positive? Well, come on, you tell me. because you got to go through the infection to get there. Speaking of going through the infection, there are a lot of questions right now about just how safe are the 20 to 40-year-olds. If you start looking at data, again, I hope I get a chance to study up and present some more of that this weekend later. It does appear, and we continue to hear from people like Farouk, I can't remember Farouk's last name, in Iran, that this was killing young people. And you start looking at some of the numbers, and some of them are indicating that, yeah, there's a lot more risk for younger people than we've thought in the beginning of this pandemic. So that's a to be decided, based on upcoming evidence. And again, don't just assume that because you're healthy and below age 40 that you have zero risk. Again, like most of these people did on the beaches in Miami. I keep referring to that. If you don't know that story, look it up. I have patients in Fort Lauderdale, they're telling me the beaches were just packed for spring break. A bunch of young people saying, A, that's silly, or B, I'm young, so I have no risk. And not really thinking about what that was doing in terms of amplification of this unprecedented global pandemic. Clyde X. Clyde, that's not, well, I don't know, maybe it is you, Clyde. The death toll in Italy rose by 627 to 4,032 today. Thank you for sharing. Judge Crater. With cigarette smokers, can the novel coronavirus attach itself to the cigarette fumes in the lungs of a person with COVID-19, with the virus getting exhaled on the tobacco smoke particles? I don't know the answer to that. We do know that obviously people with cardiovascular disease and lung disease, both of which come from cigarette smoking, are at significantly increased risk. Is there a mechanism for acute increased risk from just the smoking itself? That's what you're asking. And I haven't seen anything at all on that. I will tell you, I was reading another Nature magazine article, and it was talking about why and how is the coronavirus so darn infectious, contagious? And it started to get into those little spike proteins that stick out from the envelope, the coat, the covering of the virus. And what they were talking about is there are some receptors, obviously ACE2 receptors, but some other receptors and enzymes that make them attach easily to multiple parts of the human body, not just the mucous membranes of the oropharyngeal cavity from breathing, but also even the intestines. So again, very, very hyped up susceptibility. I hope to be able to present some interesting graphs and charts from Nature magazine showing comparisons of case fatality rates plus R0, or the reproductive index, for different viruses such as the old SARS virus, much higher fatality rate, but maybe a little bit less infectious, the old Spanish flu, some things like that. I've covered some of that before. This time, again, great article in Nature magazine, which has it more in a chart form. One of the charts in that article, by the way, had to do with environment. And it showed pollution in China in January compared to pollution in China, I think it was late February, maybe early March, and it's greatly decreased. Wonder why. Okay, Kay King, praying for Italy. I'm sure the Italians appreciate that. Soundtrack TV, wondering your thoughts about the HCQ treatment. HCQ treatment. Don't know what that is. Maybe you could give me a little bit more clarity regarding HCQ. Being discussed and currently tested. How long will they know if it's effective? P.S. Following your advice, I've dropped 35% cholesterol. Thank you. Well, thank you for being interested in my advice. Thank you for tuning in, and thank you for investing your time and effort in that. I love it when I hear that kind of feedback from folks. Bart Robinson, yes, good question, Soundtrack TV. Guys, I'm sorry, if you could just clarify for me what you mean by HDQ. Maybe it's something that's just bounced right off of my head. Maybe it's something that I haven't seen yet. I don't know. I'd love to get a little bit more detail. K King, easy to make homemade bread. Look, YouTube, Jenny can cook. Clyde X, best if your camera is on, Doc. Oh, I think that is Clyde. And I thought my camera was on. Oh my gosh. Maybe it isn't. Can't see you. Let's take a look. Yes, the camera should be on. Let me go back and look at something else. I can't believe it. You know what? There are plenty of other YouTube channels that, you're right. Duh. Well, you know what? Thank you, Clyde. Thank you for attending. Thanks for your comment, and to other folks. So sorry. You know, again, this is the first time I've done this type of webcast YouTube live without Clyde and Carl. You know, these guys, especially Clyde, have been huge in terms of helping me walk through the technology. If you've been to a public event like a football game, you know, they've got these giant trucks and they've got these people inside. The trucks have these major receptor antennae on them. They've got 3 or 4 cameramen and interviewers out there. And they're getting all of this technology, all of these streams into the truck. They've got a team of people figuring out what stream we're going to take. Then they're sending it out. But wait a minute. Why did that take such a weird turn? Here's why. This thing about not presenting my camera. This is switcher technology, just like you see in those trucks at the football games. And so I'm trying to operate that as well as think through the presentation. I screwed up the technology again, but we get a lot of great reviews, a lot of interest. Thank you again for putting up with my problems with the technology. K King, okay, so now we got a camera, now you can see me. Some restaurant supply companies might love to sell you some of the food that the restaurants are no longer picking up. Yeah, obviously there's been a huge increase because restaurants are shutting down. There's been a huge increase in takeout and delivery. San Diego Urban Homestead Aquaponics. Is zinc and quercetin okay for people on ACE inhibitors? Yeah, I don't know any reason why somebody with ACE inhibitors could not take zinc and quercetin. Somebody help me out here. Oh, and beta blockers and aspirin. Yeah, again, same thing. I'm not aware of any drug-to-drug interactions on those. K King, hydroxychloroquine is what they are saying may cure this virus. Well, before synthetic meds, the natural cure that they copied was Peruvian bark. I think you might be referring to some types of bark might have been the original sources and may continue to be sources for chloroquine and hydroxychloroquine. And I agree with you. I think hydroxychloroquine is a bright spot in this picture with a lot of hope. Like everything else, there's a lot to learn, and including getting actual confirmation on this. K King, Peruvian bark you can get online or at herb store. San Diego Urban Homestead Aquaponics. Are mesenchymal exosomes good prior to COVID? Since it's anti-inflammatory, I was going to do it anyway after a heart attack. There's been a lot of interest in mesenchymal exosomes. I've had some people that supply those really market me hard because of my what I do. You know, my internet presence, my global footprint, and they're wanting to get me to go ahead and look at those. I've looked at them, not hard enough to say yay or nay. I still have an interest in them, but here's part of my problem. Given such a wide footprint, I've got, like I said, patients all over the world, and most of my patients are in the United States. I'm licensed in about 40 states, and I've got patients in most of those states. I don't use testosterone, for example, because in many, if not most states, testosterone is a controlled drug. That for similar reasons, I'm a little bit I'm significantly nervous about using something like exosomes. Again, may turn out to be really worthwhile, but as you see, people are thanking us multiple times each month where they've had huge impact on their health. I'd hate to jeopardize the ability to have an impact on people for cardiovascular disease and now COVID-19 because I decided to start using testosterone or something that's not completely tested yet, like exosomes. So Ken Patu, good to see you, Ken. Why are the cases in Japan relatively low while their subways are still extremely crowded? Great question. I didn't know their subways were still extremely crowded, but I did know. And you'll see it on some of the follow-up YouTube videos that I do, or live event videos that I do later this weekend. Japan is very well controlled. I had made some assumptions when I looked at that they were doing a significant amount of testing, and B, I can tell you from having visited Japan a few times, the Japanese are fastidious in terms of at least hand-to-mouth type of control. They also were one of these groups, one of these cultures that used a lot of masks. I don't think the masks have done them a whole lot of good. I clearly would not attribute their low case rates to masks. I think they are probably doing a lot of the case identification, tracing, and quarantine, but we'll find out as we dig a little bit deeper into that issue. Soundtrack TV, hydroxychloroquine, sold under the brand name Plaquenil, among others, is a medication used for the prevention and treatment of certain types of malaria. That's correct. And it's also used for some other diseases, like especially lupus. Clyde X, with or without camera, content is great. Thank you again, Clyde. I appreciate that. Hull 39, any relationship between blood sugar, carbs, and coronavirus susceptibility? Well, here's one thing we do know, that if you've got significant diabetes, as in diabetes with full-blown problems like eye disease, etc., then yes, you're greatly increased risk for COVID and severe COVID problems. Now, here's where those of you who've seen my channel and watched our content before you probably know where I'm going. So the assumption is if you've got just plain old early diabetes, or especially if you've got prediabetes, that's not really a risk. And you see the CDC making similar types of statements in the stuff that I covered earlier tonight. What the vast majority of our medical community is thinking, and it's a mistake, is to think that you only have tissue damage if you have advanced diabetes. Here's the thing, there's plenty of research. It's out there, it's easily available. And it shows that by the time we get a diagnosis of type 2 diabetes, this is the first diagnosis, not complications of diabetes, but first diagnosis of diabetes, between 1/3 and 2/3 of us already have damage to nerves, damage to our eyeballs, and and clearly damage to our arteries. So we're getting this damage. In fact, I would estimate and say we get far more damage associated with prediabetes because it's so common and we ignore it. So yeah, I'd be very concerned about prediabetes. If there's one major theme within our practice and this channel, it's trying to get people to understand prediabetes is extremely common, as in maybe over half of us, not just over half of us age 60 and above, but over half of us age 30 and above. And if you don't believe that, you can go back to a study a couple of years ago by the UCLA. And that's what they showed. And over half of us, not 60 and above, but over half of us 30 and above. Prediabetes is dangerous, it's lethal, it's silent, we don't know it, and it's damaging our tissues and killing us. Do I think that it's not a significant risk for COVID, just like it's a significant risk for heart disease, kidney disease, and blindness? Of course I do. So thank you for your patience in putting up with my rant. Let me just say one other thing about how well known prediabetes is. You see comments in our channel all the time. Hey doc, I got a OGTT or an insulin survey, or I got the Libre and started watching my blood sugar. I have full-blown diabetes, not pre-diabetes, full-blown diabetes. And my doc has been telling me I'm fine. I've got no problem. So again, very, very under-recognized. We cover content which shows that the majority of the medical community out there, primary care practitioners, internists, family practitioners, spend way too little time focusing on prediabetes. That research would show that those docs tend to blame the lack of focus on prediabetes on patients. And to their point, you know, they come out of their training very interested and focused on getting people to do some of the basics, like losing weight. After suggesting to 100 people that they lose weight, and they're lucky if one actually does it, they lose hope. Now, I'm not making excuses for docs. Docs need to change what they're doing too. We as a culture, you can't blame just the docs, you can't blame just the patients, you can't blame just the insurance companies. All of us have a hand in our lack of healthy lifestyle, our lack of awareness of the damage that it does to us. So, Hull 39, I know that may have been sort of a sideways way of answering your question, but I hope it got the points across. Gary Hale, with everything blooming in Florida now causing itchy eyes and coughing and sneezing, what then is the symptom that should cause you to get a C19 test? Well, Gary, I don't know if you actually saw the original presentation. Basically, the CDC is sort of in a circular way saying, just get the test if you have been hospitalized with COVID-19, or you're taking care, your healthcare provider taking care of somebody with COVID-19. If you have risk factors, you need to be worried, but really think more about symptoms. And again, on a practical basis, I understand exactly where they're coming from. There are no test kits out there. Testing is not available yet, but it will be next week. And I do expect to see and hope to see significant changes in the CDC recommendations. So symptoms, and I haven't had a chance to call my ophthalmologist friend, Craig Brown. He's been sharing some information on this, and sure, some of the original symptoms that people are reporting is itchy eyes, conjunctivitis, red eye. So that's clearly something to think about. Old Alabama Gardener, OAG, glad to hear from you. Glad to see you joining us tonight. COVID-19 is an example of how a country does not need to attack with nuclear weapons to bring America or the whole world to its knees. Yep, there's a whole lot of actual conspiracy theory wrapped around that as well. Hydroxychloroquine, can I mail order HCQ? Oh, that's what you're talking about. Somebody asked earlier about HCQ. You're talking about hydroxychloroquine. I have talked about hydroxychloroquine a couple of times. I knew it. I knew there was some sort of silly connection that I was not making in my brain. Bart Robinson, OAG, excellent point. So folks, thank you very much. We're getting to the end of the comments. A lot of great interest. And again, I'm especially excited about it for two reasons. Number one, it was unscheduled. Well, it was not only unscheduled, I didn't even get an email out about this because I don't know how to do the technology to get the emails out there. But here we are with a lot of people on board, a lot of people watching, a lot of people commenting. Thank you very much for your interest. And I will tell you, I'm going to try to figure out how to schedule this to get a little bit more heads up and word out there that we're going to have it. But we hope to cover things like a lot of neat nature articles, things like the importance of case finding, outbreak detection, cluster detection, case isolation, and quarantine, as opposed to just what's going on now, which is just social isolation. Very important component. It's been used effectively in places like South Korea, especially the testing and then the case investigation and quarantine based on that. So I hope to cover a good article on that. Hope to cover some articles on things like other impacts associated with this, like impact on the environment. Cover an article with some great infographic or some graphics on lethality versus R0, the reproductive index. Some interesting articles on just what it is biologically that makes not COVID, coronavirus, this one, so infectious, so contagious. So stay tuned, keep your eyes out. I don't expect many of you are going anywhere. So maybe we can entertain each other by learning a little bit more about what's going on in the world today with COVID, and how we can use this information to stay healthy. Thank you very much for your interest.